So Nathan, we talk to our clients about retirement planning, making sure their assets last. The thing that people often forget is how to fund that last step, the care requirements later in life.
What's really important in all of these areas of thought is that there is a plan. Most commonly when people come to see us for aged care advice or home care advice, it's at that last minute. It's usually the child of a parent who is going through a medical issue and it's go, go, go. We've got to get them in the home, they're in respite, what do we do, how do we fund it? And this is high stress. The best time to start thinking about this is earlier, because that really enables you to come, I suppose, more to terms with what the plan is. And that also allows you to start setting up things like where you're living. And that would then start setting up your retirement plans. When do we downsize? And it all filters back from there.
How do you approach it practically?
That conversation is so difficult to have. And it's always important to remember that the client for us as an aged care advisor is the person going into care. What are their care needs? Where are they most comfortable? Proximity to family members, friends. How do we keep as much normality as we can? And then from there, we can start looking at the next stages.
So if someone comes in and they're concerned about their mother, do you have any suggestions on how they can approach this conversation?
The universal way to think about it is empathy. You have to put yourself in their shoes and allow yourself to feel what they feel and realize that they are probably aware, if not in denial, around the fact that there is a losing physical or cognitive capacity. And that would scare anyone. It's very hard to bring this up earlier than there being a substantial event, whether that be a fall, whether that be a health scare, anything like that. Important thing for families to remember, if there's multiple parties, is that you have a consistent message. Ideally, we want everyone who is relevant to that question to be in that room. If it's mum's had a stroke or dad's had a stroke and they're in a home and we've got early onset of dementia or their cognition is not quite there, then it's not really practical nor helpful to bring them into that conversation. And that's where powers of attorney and having a power of attorney is really important. And any siblings that want to be a part of that discussion, bringing as many of them into the room as possible, or at least informing them, is really important. And that also gives the power of attorney a bit of peace of mind that everyone knows what's happening, so I'm not going to have to stress about that.
Say someone is approaching a point where they need further care, but they're not ready to move into an aged care facility. Is there other options?
Within the aged care system in Australia, that's the funded system, we have a number of what's called packages, which allow for home care funding. Once you're over 65, you are over a benchmark for that. And then you can register to have an assessment. And even the most basic package is an hour a week of help around the house. You can also access private care. And with the right financial plan and right assets around you, paying for that quality of life is really important. Some people are a little resistant, because it's facing down the idea that you might need help.
Or your parents.
Or your parents. But I always say, it's just an extension on the age pension. Really, it's the government paying for someone to come mow your lawns.
If you're in this position where you or your parents are starting to worry about this, have the conversation with your advisor.
Absolutely, sooner rather than later, even if it's just to understand, maybe it's to establish some home care, and everyone's situations are different. But this is an extremely complex area and it gets so confusing, and amongst the financial side, there's all the emotional side. But I think the more we talk about it earlier, the less shock there is later. We'll actually be running a seminar at the end, around mid-June, to keep an eye out for those dates. This will be an open session for anyone, not just clients of Tribeca, to join.